With coronavirus testing still severely limited by shortages in everything from cotton swabs to the reagent chemicals labs need to process them, there is growing hope that a different kind of blood test will soon help states play catch-up.
Should that become a possibility to have a dependable and verified antibody test, I think we would be very interested in partnering.
The Mayo Clinic might soon be that partner. After 3 weeks evaluating 5 different antibody tests, doctors at the Mayo say they can now reliably detect whether a person has ever been infected with the novel coronavirus.
Early next week, we hope to have the test available for clinicians to order and to start using.
Dr. Ellie Thiel says antibody tests will not replace the current molecular tests because they aren't effective until after someone recovers.
So it takes many days, multiple days, typically 8, 9, 10, 11 days in some cases to detect an immune response to the virus.
So why is it worth the wait? For one, the plasma of a COVID survivor could be donated to someone infected as part of an experimental treatment. But there's an even bigger upside.
Potentially to help redeploy healthcare workers and other individuals back into the workforce. So there's multiple potential uses.
This is going to be that critical piece to helping us get back to normal a little bit?
It is. It's an important test from a public health perspective.
It's also important because unlike the current tests, there are fewer supply chain problems that might slow it down.
We don't need swabs. We just need regular venipuncture collection tubes. It's a higher throughput, but the reagents are much more widely available. So it won't be as big of a problem as molecular testing.
Essentially, you can do more tests in batches?
Yes, that's right.
Thiel says it will take a couple of weeks to expand tests beyond the Mayo's own facilities, but MDH says it will be watching and waiting.
Absolutely. We'll be intending to put that to use as soon as we can.
Kent Erdahl, KARE 11 News.